Fundamentals of Nursing Beginner Questions. Question 1. While teaching a newly hired nurse about varicella, a nurse in a pediatric clinic should include which of the following information? Children who have varicella are contagious until vesicles are crusted. Children who have varicella should receive the varicella chickenpox vaccine. Children who have varicella should be placed in airborne precautions. Children who have varicella are contagious 12 days before the rash appears. Children with varicella chickenpox are contagious until all vesicles are crusted over. Question 2. A healthcare provider is reviewing the laboratory report of a client who has been taking lithium carbonate for the past 12 months. The provider notes a lithium level of 0.8 MEqL. Which of the following orders from the provider should the healthcare provider expect? Withhold the next dose. Increase the dosage. Discontinue the medication. Administer the medication. A lithium level of 0. Question 3. A client with fibromyalgia requests pain medication. Which of the following medications should the nurse administer? Pregabalin, lorazepam, colchicine, codeine. Pregabalin is commonly used to manage pain associated with fibromyalgia. Question 4. A client is to receive a transfusion of packed RBCs. Which of the following actions should the nurse take? Prime 4 tubing with 0.9 sodium chloride. Use a 24-gauge 4 catheter. Obtain filterless 4 tubing. Place blood in the warmer for 1 hour. Prior to administering a blood transfusion, it is essential to prime the 4 tubing with 0. Question 5. When caring for a toddler with acute lymphocytic leukemia, in which of the following activities should the toddler participate? Looking at alphabet flashcards. Playing with a large plastic truck. Using scissors to cut out paper shapes. Watching a cartoon in the dayroom. Toddlers with acute lymphocytic leukemia may have compromised immune systems and need to avoid activities that increase infection risk. Question 6. A client has chronic pancreatitis. Which of the following dietary recommendations should be made? Coffee with creamer. Lettuce with sliced avocados. Broiled skinless chicken breast with brown rice. None of the above. Chronic pancreatitis requires a low-fat diet to reduce stress on the pancreas. Question 7. A healthcare professional is preparing to assess a 2-week-old newborn. Which of the following actions should the professional plan to take? Obtain the newborn's body temperature using a tympanic thermometer. Faces pain scale. Auscultate the newborn's apical pulse for 60 seconds. Measure the newborn's head circumference over the eyebrows and below the occipital prominence. Assessing the apical pulse in newborns is important to evaluate their cardiac function. Question 8. A client who is at 38 weeks gestation, is in active labor, and has ruptured membranes is being cared for by a nurse. What action should the nurse take? Insert an indwelling urinary catheter. Apply fetal heart rate monitor. Initiate fundal massage. Initiate an oxytocin 4 infusion. When caring for a client in active labor with ruptured membranes, the priority action for the nurse is to apply a fetal heart rate monitor. Question 9. A client is being assessed by a nurse who is 30 minutes postoperative following an arterial thrombectomy. Which of the following findings should the nurse report? Chest pain. Muscle spasms. Cool moist skin. Incisional pain. Chest pain is a critical finding postoperatively, especially after an arterial thrombectomy, as it could indicate complications like myocardial infarction or pulmonary embolism. Question 10. A healthcare professional is completing an incident report after a client fall. Which of the following competencies of quality and safety education for nurses is the professional demonstrating? Quality improvement, patient-centered care, evidence-based practice, informatics. Completing an incident report after a client fall aligns with the competency of quality improvement, which focuses on identifying system errors and implementing changes to improve patient outcomes and safety. Question 11. A nurse is talking with another nurse on the unit and smells alcohol on her breath. Which of the following actions should the nurse take? Confront the nurse about the suspected alcohol use. Inform another nurse on the unit about the suspected alcohol use. Ask the nurse to finish administering medications and then go home. Notify the nursing manager about the suspected alcohol use. Confronting the nurse about the suspected alcohol use is the most appropriate action in this situation. Question 12. A client has diaper dermatitis. Which of the following actions should the nurse take? Apply zinc oxide ointment to the irritated area. Wipe stool from the skin using store-bought baby wipes. Apply talcum powder to the irritated area. None of the above. Diaper dermatitis, also known as diaper rash, is a common condition in babies or clients who wear diapers. Question 13. A healthcare professional is receiving a telephone prescription from a provider for a client who requires additional medication for pain control. Which of the following entries should the healthcare professional make in the medical record? Morphine 3 mg subcutaneous every 4 HRPRN for pain. Morphine 3 mg subcutaneous. Morphine 30 mg subcutaneously every 4 HRPRN for pain. Morphine 3 mg subcutaneous Q4 HRPRN for pain. The correct entry for documenting the prescription for morphine is morphine 3 mg subcutaneous. Question 14. A healthcare professional realizes that the wrong medication has been administered to a client. Which of the following actions should the healthcare professional take first? Notify the provider. Report the incident to the healthcare facilities manager. Monitor vital signs. Fill out an incident report. In a situation where the wrong medication has been administered to a client, the immediate priority is to assess and monitor the client's vital signs to identify any adverse effects of the incorrect medication. Question 15. A client is experiencing preterm contractions and dehydration. Which of the following statements should the nurse make? Dehydration is treated with calcium supplements. Dehydration can increase the risk of preterm labor. Dehydration is associated with gastroesophageal reflux. Dehydration is caused by decreased hemoglobin and hematocrit. Dehydration can lead to an imbalance in electrolytes and cause uterine irritability, potentially leading to preterm contractions. Question 16. During a shift change, a nurse is receiving a report for an adult female client who is postoperative. Which of the following client information should the nurse report? High platelets, hypertension, lower platelets, high temperatures. Lower platelets can indicate a potential risk of bleeding in a postoperative client. Question 17. A nurse manager is developing a protocol for an urgent care clinic that often cares for clients who do not speak the same language as clinical staff. Which of the following instructions should the nurse include? Use a professional interpreter service. Nurse to interpret. Provide translation services for a nominal fee to clients. Evaluate the client's understanding at regular intervals. In situations where there is a language barrier between healthcare providers and patients, it is essential to ensure accurate communication. Question 18. When preparing an inservice on malpractice issues in nursing, which of the following examples should the nurse include in the teaching? Leaving a nasogastric tube clamped after administering oral medication. Documenting communication with the provider in the progress notes of the client's medical record. Administering potassium via 4 bolus. Placing a yellow bracelet on a client who is at risk for falls. Administering potassium via 4 bolus is a high-risk procedure that requires careful attention and adherence to established protocols to prevent serious complications like cardiac arrest. Question 19. The client is receiving discharge teaching for a new prescription of phenelzyne. The nurse should instruct the client that it is not safe to eat which of the following foods while taking this medication? Whole grain bread, avocados, smoked salmon, pepperoni pizza. In this scenario, the correct answer is B, avocados. Question 20. A client has experienced a right hemispheric stroke. Which of the following is not an expected finding? Impulse control difficulty, left hemiplegia, loss of depth perception, aphasia. In a right hemispheric stroke, the expected findings include left-sided hemiplegia choice B, loss of depth perception choice C, and impulse control difficulty choice A. Question 21. A client has left homonymous hemianopsia. Which of the following is an appropriate nursing intervention? Teach the client to scan the right to see objects on the right side of their body. Place the bedside table on the right side of the bed. Orient the client to the food on their plate using the clock method. Place the wheelchair on the client's left side. In a client with left homonymous hemianopsia, there is a loss of vision on the right side of both eyes. Question 22. A healthcare professional is planning care for a client who has dysphagia and a new dietary prescription. Which of the following should the healthcare professional not include in the plan of care? Have suction equipment available for use. Feed the client thickened liquids. Place food on the unaffected side of the client's mouth. Assign an assistive personnel to feed the client slowly. When caring for a client with dysphagia, it is crucial to ensure safe feeding practices. Question 23. A client has global aphasia affecting both receptive and expressive language abilities. Which intervention should not be included in the client's care plan? Speak to the client at a slower rate. Assist the client in using flashcards with pictures. Speak to the client in a loud voice. Give instructions one step at a time. Individuals with global aphasia have difficulty understanding and expressing language. Question 24. A healthcare professional is assessing a client who has experienced a left hemispheric stroke. Which of the following is an expected finding? Impulse control difficulty, poor judgment, inability to recognize familiar objects, loss of depth perception. Patients who have experienced a left hemispheric stroke may exhibit symptoms of agnosia, which is the inability to recognize familiar objects or people. Question 25. Prior to a thoracentesis, which of the following actions should the nurse take? Position the client in an upright position leaning over the bedside table. Explain the procedure. Obtain ABGs. Administer benzocaine spray. Positioning the client in an upright position leaning over the bedside table helps to facilitate access to the thoracic cavity during the thoracentesis procedure.